Dr. Sharma, with the new influx now, how is the CoWIN software managing?
CoWIN software is managing absolutely wonderfully. It has managed 8.6 million day before yesterday. It has managed more than 5 million yesterday. And it has managed 1.5 crores, around 1.5 crores registrations in a matter of 8 hours on 28th of April. So I think the system is stable, scalable, and is able to manage the load which it is put on.
Has the capacity of CoWIN now increased ever since the policy switch by the government of India?
Yeah, we have always, our policy, our capacity is very flexible. So we are able to increase the capacity as and when there is a demand on its capacity.
And what's the capacity now, sir?
I don't tell you. I can only say that it can handle as much numbers as are coming to it.
All right.
Just to be more helpful, I can also say that we keep on doing what is called a load test. And load test is essentially a test which, you put your software under stress and plug in so many number of transactions. So you bombard the software with the transactions, and then it is able to sustain. Then you are able to say with certainty that you will be able to take care of numbers.
All right. So are there any third-party collaborations which are in the pipeline?
There have been third-party integrations in the past with the basically with the view to increase the coverage in terms of reach of CoWIN to far-flung areas. So that's one part. Secondly, that will continue as and when new applications are received, we will continue to clear those applications for partnership.
There's a lot of international interest when it comes to CoWIN. Are there any collaborations that the government could do?
Not yet, but a number of countries have expressed interest in the platform. And we are going to have a global conclave on 5th of July to basically share what we have done in CoWIN. And there are a lot of interest, especially from many countries in Africa. So that we will be sharing. And in case they require to establish a similar type of system, our Prime Minister has directed us that we should provide our software free of cost to those countries as a gift. So I think we will be doing that as and when we receive the requirements or the interest from those countries.
Which countries could these be, sir?
Well, it's a developing situation in the sense that once we have announced the conclave, there are many countries who are expressing to join the conclave. Number one. Number two, our Ministry of External Affairs have reached out to various countries. Invited them, so to say, and they are the ones who are keeping count as to who is interested in what form they are interested in. So maybe you could talk to the Foreign Secretary, or you could talk to anybody in the Ministry of External Affairs.
My last question, Mr. Sharma, is that now, since registering on CoWIN software is not mandatory before getting vaccinated, what is the ratio that you're seeing? Are more people registering first, or have that you've seen a slowdown in the registration as far as the CoWIN software is concerned?
Runjhun, I think this is one of the myths which has been created about CoWIN. CoWIN had never mandated registration. In fact, since the very beginning, we had said that walk-ins are allowed, and so therefore you could just go without registration. However, all the vaccinations are recorded on the CoWIN software, which means to that extent, every vaccination has a record on our system. But registrations or bookings were not mandatory. And just to give you an idea, 80% of the people in this country thus far have taken their jabs without registration or booking. So they have just taken the injection by coming to the center directly. So it has never been mandatory. It is still not mandatory, and majority of the people, rather an overwhelming majority of the people, are actually going and doing a walk-in. And we have no issues with that because walk-in does not degenerate or compromise the quality of vaccination in any case, because all the data digitally is available, and we are able to monitor the vaccination progress. We are able to ensure that a person who gets vaccine X in the first dose also gets the same vaccine in the second dose. We are able to effectively remind people that their jabs are due, and we are able to establish a very meaningful communication with the people. We are able to record their AEFI, that is adverse effect following immunization. That all those things are being done.
Also, many experts have said that CoWIN should have an option of registering your adverse event post-immunization. Say, for example, even if you have fever, there should be an option of going to CoWIN and saying that I did experience, so and so adverse event post-immunization.
Well, the point is that CoWIN does capture the adverse effects for following immunization within 30 minutes of the immunization. Thereafter, there are systems, systems created by ICMR, systems created by the state governments where you are able to, sort of convey to them, and those systems also are recording these events. So it's not really CoWIN alone which does the job, because basically what will happen, Runjhun, you should understand that within 30 minutes, the entity which is actually doing the vaccination is responsible for taking care of any adverse effects, right? So therefore, just recording in CoWIN basically just makes the CoWIN aware of the trend of adverse effects which are happening. But after 30 minutes, when you go home and when you develop a problem, it's not merely a recording problem, it's also a problem which requires solution, which means you require advice as to what medicines you to take, you require advice which center you should visit, etc., etc. So that is something which actually CoWIN, which is just a software for vaccination, will not be able to handle. And therefore, other systems are there which are actually taking care of this issue.
All right. Thank you. Thank you, Dr. Sharma, for speaking.
Thank you, Runjhun, for having me on this platform.